Okay, Dr. Hubner here, Natural Transplants. I'm here with my patient of the day, Tanya, and we're very excited, and she's here with her husband, Damien, and Damien is going to be watching the procedure today, and I'm very excited because he's a salon owner. He's very curious about how the process works and, of course, the results, so we're going to show everything today. It's very rare that we have a female being willing to talk about her experience and how it has her hair loss, so I'm very excited. And I know this will be a really good resource for a lot of women out there that are looking to maybe doing something to really help them out. So I want to tell you Tanya's story. Basically, Tanya has it's not a common genetic pattern of loss. What she has is traction alopecia. What traction alopecia means is that basically tension is put on the hair for long periods of time, either in the form of a braid or the way the hair is brought back, sometimes with cornrows or other types of styles that put a lot of pressure. And over time, sometimes the follicle just never comes back. And these over time just get thinner, 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 and then they're here wanting to get it done. So you can see that her hair, other than the area we're working in, her hair is very, very thick and she has very, very good density. But you can see where her hairline used to be, and you can even come here a little closer, Josh, and show, but you can see that her hairline used to be way up here. And you can see how spacey all of this is. So this is a very, very nice example of traction alopecia. And it comes on both sides. You can see that her temples used to be a little bit stronger. And all she has left is just some small amount of remaining hair. So I'm very, very excited. When did you start noticing this happening for you?
Around like 2006, 2007. It's actually me being pregnant, not wanting to do my hair, and I was getting the braids and pulling them up, taking them down, pulling them up, and for 9 months just wearing them. And after a while, it just started getting thinner and thinner.
Okay.
And then I noticed that it wasn't going back.
Yeah. How does that affect you? And does it affect your everyday life?
It actually does, because you have to constantly try to cover it in some kind of way. You're trying to find hairstyles that you have to pull your hair over to the side or wear it down, and it limits you from being able to pull your hair back in a ponytail and things like that, basic stuff that you used to do, and it's like it's real self-conscious.
Okay, awesome. And how did you find us? How did you find Natural Transplants? Where else did you look?
I went to my dermatologist, and for a couple of years I've been like researching it, and I went online and was Googling different names, and of course you are one of the ones that popped up, and then you have YouTube, so yeah. I went looking at your YouTube videos, and then and other people that have this, they don't show the results. They don't show, like tell what's going on, show what happened later, and they don't in the advertising. So you just intrigued me. So when I called and talked to Josh, he got me all hyped up and excited about it. So
awesome. We're hyped up as well, excited for you as well. So we'll be stopping throughout the day, showing pictures. We'll show the hairline, and looking forward to seeing some great results, Tanya. Thank you so much.
Thank you. You're welcome.
You want to talk a little bit about what you see in the salon?
Well, yeah, just in the salon, just like you said, the traction alopecia. What happens is a lot of the young women that comes in there, they're always thinning around this area when it goes to like lace fronts or glue, or when it comes to the sew-ins and different stuff like that. They're having so much abrasion or so much damage to the same area as my wife, like you said, the traction alopecia, to where now they're just trying to cover it up. I'm here today just to see how the process works, so I can refer a lot of my clients and a lot of my stylist clients to this process as well. So if it goes good, we'll see.
Okay, I'm here with Tanya, and we are about a third of the way through the procedure. At this point in the procedure, the anesthesia's been done, the strip's been removed in the back, so our techs now are working on sewing it back up. And Tanya, how's your day been going so far? Tell us about the anesthesia part. How was that?
I didn't feel it. I have a high pain tolerance, so I have tattoos, so I don't know. It didn't hurt me.
And she's married too, apparently, so her pain tolerance is off the charts. But no, I'm just kidding. So no, but he's been here the whole time. Damien's been watching, and he's been asking a lot of good questions. So it's always nice to have family members in asking questions, and But okay, so basically the strip's out. You're sewing up. I'm going to show you what we did around here in the front.
Okay.
So well, not in front, in the back rather. So I want you to see how big that suture is, or how big that scar is going to be in the back. So you can see how perfectly approximated it is all the way around into that good hair. And yep, that's going to be really easy for her to hide because she has all this hair up on top that's just going to fall right down over it. So women always worry about what they're going to look like afterwards. What we have to look for is basically you're going to have scabs in this area here. But she fortunately has some hair she's going to bring forward, and hopefully with a stylist they can work out a way to cover things up. So, all right, we'll be checking in on you a little bit later, and can't wait to see how it looks.
All right, me too.
Okay, Dr. Huebner here. I'm here with our patient Tanya, and we have just completed her surgery. I'm very excited. We were able to move a lot of hair for her. We actually got her a third additional strip and just jam-packed the temples and the top. In the areas of traction alopecia, which she had. Tanya, how was your experience today?
It was good. I didn't think it was going to go as smooth as it did, but I have no complaints at all.
Oh, cool. And it's cool because I can see where your new hairline is going to be and how it's going to look. It's kind of hard to see that because you're not used to seeing how it looks. But trust me, it's going to be a great result for you. You're going to be able to finally wear your hair back in a ponytail and not have to worry about all these areas. So
awesome.
Yes. Is there anything you would say to women that are thinking about doing this, or potentially?
I would say don't be embarrassed about the way you look at, because I look like ET right now. But I know that when the year comes and my hair is back, I'm going to be really satisfied, and I won't ever have to deal with it again. So just don't be afraid to make that step to take care of your appearance, and don't be afraid to just get it done.
Awesome. And no more braids for you.
No more braids. No more braids.
Excellent, excellent. Well, thanks once again for letting us show people, particularly women, what the process can be like. And really look forward to seeing your results. And you can call us anytime. Naturaltransplants.com. Thanks.